Hello, ladies and gentlemen. I'm Richard Sullivan from Guy's Comprehensive Cancer Centre and King's College London. Well, in 2013, the great French sociologist Thomas Piketty published a remarkable book. It was called Capital in the 21st Century. What it basically did was demolish the idea that the world was becoming a more equal place. What he showed very clearly was we're beset with significant problems in terms of income and wealth inequalities. And already these are being translated into the health arena. Across Europe, the health divide has grown ever wider over the last 2 decades, and it's being acutely felt in cancer care. We're seeing inequalities in terms of the chances of you developing cancer because of the lack of public health measures in many countries. We're seeing inequalities in terms of delays in diagnosis, patients being often delayed far too late in many countries because of the inability to access good diagnostic pathways. We're also seeing inequalities in access to some of the most fundamental and basic high-quality treatments. This means patients moving across countries to seek better care, and also leading, of course, to worse outcomes, be they in curative or palliative settings. And finally, we're seeing inequalities in survivorship as well, with some survivors being looked after very well by their social care systems in their countries and others really being thrown on the scrap heap. These inequalities, of course, will set Europe back decades, and particularly now with the COVID-19 pandemic, creating ever greater stress and downward pressure on our health and social care systems. On the 18th and 19th of November, we're holding a special session to discuss exactly where we are in terms of inequalities in outcomes, access, delays, and public health germane to cancer. And we're beginning looking at the solutions and the hard political choices that politicians, clinicians, and the public are going to have to make across Europe in light of the COVID pandemic over the next 5 years. Please do join us. It's going to be a fascinating session, and we'll look forward to seeing you there.